So I'm going to show you how to brush the teeth. Firstly, ideally use a small-headed, medium bristled toothbrush. Soft if somebody's really suffering with sensitivity, but hard is too hard. So ideally, medium bristled, small-headed toothbrush. And then try and have a little bit of a system to make sure that you know where you've been. I generally start at the very back, at the top, and toothbrush bristles are half on the tooth and half on the gum, and use small little circles. Try not to scrub backwards and forwards. You can cause quite a lot of damage to the tooth and gum surface. You want to do nice little circular motions and just bring it forward. When you turn your toothbrush around to go the other way, make sure you start where you left off. I often see quite a lot of plaque in this area here where people have started further on. So start where you left off, take it all the way round to the other side. Nice little circular motions. And remember, if you see blood, keep on brushing. Exactly the same on the inside surfaces. The tops of the teeth where you bite, you can actually scrub. This will be fine. And exactly the same on the lower surface. If you're using an electric toothbrush, even simpler, just slowly walk that toothbrush with the bristles half on the tooth and half on the gum. Slowly walk it. And just a little tip for getting to those awkward to reach places behind the front teeth, top and bottom. Tip the toothbrush in the air, just use the very toe or the very tip of the toothbrush and make the little movements like that. Exactly the same on the top ones. Vertically rather than horizontally, and it will help you to fit into that area a little bit better. So remember, clean your denture over something that it's not going to break if you drop them. Really important to clean this fitting surface. This is the bit that sits next to the skin, just as much as the rest of the denture. I'll just show you a couple of specialist toothbrushes. This one is a Dr. Barman's toothbrush. This one is a Collis Curve. The idea is that they have 3 surfaces so that you can cover more area in a quicker space. They're not brilliant, so if you can use a normal toothbrush, always go for a normal toothbrush, but this might just help if you've got a limited amount of time. Exactly the same with the Collis Curve. So I'm just going to show you how to adapt a normal toothbrush to make it a little bit easier to grip. So I've just got a normal toothbrush, a flannel or a dishcloth, wrap it around, and a hairband or an elastic band will just help to give a little bit more grip and make the toothbrush easier to use. If you need to use some fixative, you don't actually have to put massive amounts of fixative onto the denture. You can see there I've put 4 little spots. It is quite difficult to do that for somebody who's used to putting quite a lot of fixative onto that area, but it's going to make it harder for you to get those dentures out and to clean the roof of the mouth as well, which will probably be covered in gunk. So lots of toothpaste contain this ingredient underlined here, sodium lauryl sulfate. This is the stuff that goes into shampoos and hand washes. It makes things really foamy. The idea was that it foams the toothpaste up so that the fluoride gets carried around the mouth. It can be quite drying, and for somebody who has a little bit of a swallow problem, you don't want too much foam either. So you might want to go for something that doesn't have this ingredient in, sodium lauryl sulfate. There are lots of toothpastes on the market that don't have sodium lauryl sulfate. This is one, Oraleve, but there's also Sensodyne Pro Enamel and Corsadil toothpaste also don't have sodium lauryl sulfate in, so they may be an alternative.